today the necessary changes in the app portal, the application module which is there, have been carried out. So cadets can apply for this particular scheme through that app. There have been other issues like since 2003-04 when the NPS came into being, and now after 20 years, a lot of persons from Coast Guard, from DGR, when they are retiring, they fall in this category. So necessary changes in the app to facilitate NPS and continuing with the authorization which was very much there for them. That is all the facilities of the ECHS at par with the TRI services are being extended. In March 2024 and thereafter in November 2024, a total of 23 new polyclinics were sanctioned by Government of India. This slide represents, if you see the last two columns in year 2024-25, we have almost 200% increase in the type A polyclinics, which initially in 2023 was 21. Today they stand at a figure of 52. So with this 23 new polyclinics, then there have been 50 polyclinics which have been upgraded. There is also an initiative wherein 75 polyclinics the buildings are being constructed under Azadi Ka Amrit Mahotsav. So all these initiatives commensurate to that increasing beneficiary base which I highlighted some time back. So when these number of polyclinics have increased, so this is the contractual manpower which as on today is working under the umbrella of ECHS. The total of close to 8,000 employees. So apart from the service which ECHS is rendering, this is the employment which is being generated. And yes, for the ex-servicemen, they have a major stake in this. If we see the figures, the medical officers and the specialists among the 8,000, 25% plus are the category, the doctors. And the second point in this is that the reach of the scheme, wherein at places when the employment was highlighted that the MOs are not available or some other issues are there. So the recent initiative of the revision of remuneration is expected to incentivize that particular issue, and we for sure will have a better availability of doctors even in the remote areas. The biggest benefit we accrue is the complete transparency. So which region, which hospital, why so many from one particular hospital organization or from a particular state, that can be addressed through this. And yes, accountability increases. The stakeholders the entire footprint will be available, digital footprint, and the entire process will become faster. As far as the rates are concerned of the treatment in these hospitals, yes, we as of now are binded by the CGHS rates, and revision of same, as told to us, is to happen in a very near future. The other initiative is with respect to the medicines availability, coupled with the tele-consultancy from the doctor for any ailment. In this regard, the door-to-door delivery today in NCR region is completely functional. It is being rolled out pan-India. The glitches which initially were there have been resolved. And once we achieve the complete door-to-door delivery, side by side with our E-Sehat initiative, soon we will be able to address the delivery especially to the 70+ years of veterans and the other infirm beneficiaries, wherein their teleconsultation and followed by the delivery of the medicines at the doorstep will happen. All the initiatives which can be taken at the service level will be highlighted to them, and we are very sure that as the time will progress, the scheme will further will hold its ground in a much better manner and will further spread into various other parts of the India. I finished with that. We are open for any suggestions from your side if there are any.
They use the facilities of Imperial Hospital, Chandigarh, Jalandhar, travel all the way. So why don't you select one of these your pilot project hospital in Himachal?
I've noted it down, sir. Sir, I will just like to highlight one thing. We are not binded by only these 21, and they are not going to be the start and end of this. It is just that the first pilot project of Delhi, once it goes through, and we will draw a lot of lessons out of it. And thereafter, definitely, there will be a relook. Definitely, there will be a relook both in the way this is being implemented as well as the region which we are going to address. Sir.
I'm Brigadier Rathod, Rajasthan. I have a suggestion to make to whoever is the highest authority of ECHS or at our MOD level who can look into it. This is a scheme which has been offered for the veterans. And we are the biggest contributors to this scheme, and we have the least amount of say in this. We can only put forward our points. Those points are handled at appropriate levels and discarded. Very rarely we get to see 3 polyclinic of Jaipur, and on the other side, western and southern side, people travel 70, 80 kilometers in today's times. So this very sore point, which I today appropriate place to you to note down, and Deputy MD is here. We must be taken in confidence. We are not here to anti-ESM. We are the people who are controlling their affairs at state level. And there you don't talk to us, we don't listen to us. I'm being a little harsh because it pinches. Like he's saying he had some issues. When you decided this, none of us were consulted. Last 5 years I've been in this business of Sani Kalyan. I have not had any communication from anywhere.
Sir, I have noted both the points down, sir. As far as the second point goes of incorporating the views of the ex-servicemen, definitely it's a very positive point, sir, and we will incorporate it. Sir, it's completely understood and it is very correct, sir. The first point with respect to why a particular polyclinic, I will just leave it to the initial statement which I made, sir. We are the final policy framework and the executive orders which we receive are from the MOD. And yes, there have been cases wherein initially we had 102. We had 102 polyclinics, and if we see, if we take care of the 23 new polyclinics, the 75 upgradations, and then thereafter few other construction, in some or the other fashion they have been addressed, but not entirely. I am aware of the Jaipur issue, sir. There is an issue not only in Jaipur, similar issue does exist in southern states also. They are in our notice, and we will take cognizance of them.